You know that strange machine at the dentist office? The one where you have to bite down on a little piece of plastic while it slowly spins around your head? Well, today, we're going to demystify that exact piece of dental tech. We're talking about the Panoramic X-ray, a tool most of us have experienced but probably don't fully understand.
So let's just jump right in with this question. What can one single picture really tell you about everything that's going on inside your mouth? Well, the answer is a whole lot more than you might think, and it's actually pretty fascinating.
All right, so first things first, let's get a really clear idea of what a panoramic X-ray actually is.
Okay, so a panoramic X-ray, sometimes called an orthopantomogram or OPG, which, is a bit of a mouthful, basically gives your dentist a kind of superpower. It lets them see your entire oral structure all at once. It's a flat, two-dimensional image that gives this incredible wide-angle view in just one single, super efficient scan.
And this is where it gets really cool. Look at the sheer scope of what this thing captures. We are not just talking about your teeth here. This one image shows your upper and lower jaw bones, every single tooth, including the ones that haven't even broken through the gums yet, your jaw joints, also known as the TMJ, your sinuses, and all the bone structure around them. It's basically a complete blueprint of your mouth.
So why do dentists need this big, wide-angle view? Well, it's because this thing is an incredibly powerful diagnostic tool.
And the practical advantages? They're huge. You get that comprehensive, full-mouth view in one shot. The entire process takes less than a minute. It's completely painless, totally non-invasive, and, this is a big one, it actually uses less radiation than if you were to get a whole series of those smaller individual dental X-rays.
But, those are just the convenient perks. The real story, the real power of this machine, is in what it can see that we can't. Its true strength is finding problems that you can't see or even feel yet. We're talking about uncovering hidden issues like impacted wisdom teeth, spotting things like cysts or even jaw tumors, checking for bone loss from gum disease, and even identifying sinus problems that might be the real reason behind your tooth pain. I mean, this is early detection at its absolute best.
So what's it actually like to get one of these? Let's walk through the process and talk about when your dentist is most likely to use it.
It really is as simple as it looks here. Step 1, you get positioned, either standing or sitting. Step 2, you'll gently bite on a small block. This just keeps your head perfectly still, which is super important for getting a clear picture. Then, the arm of the machine just smoothly rotates in a semicircle around your head, and bam! In just a few seconds, that detailed image is created. That's really all there is to it.
So, when might you actually need one? Well, your dentist will probably want one to plan for wisdom teeth removal or to see how your jaw's growing before you get braces. They're also key for assessing TMJ problems, checking to see if you have enough bone for dental implants, and, really, for investigating any other potential hidden issues.
Okay, I'm sure you've got some questions, so let's run through some of the most common concerns, rapid-fire style.
First up, the big one everyone wants to know. Does it hurt?
Absolutely not even a little bit. The whole thing is super quick, it's easy, and there is zero discomfort involved.
All right, next. The word X-ray always brings up a valid question about radiation. So, is it safe?
Yep, it's considered very safe. Modern digital X-ray machines are amazing. They're designed to use just a minimal amount of radiation. Now, the one really critical piece of advice here is to always let your dentist know if you are, or even think you might be, pregnant. That's just a necessary precaution. So how is this different from those little X-rays they stick in your mouth? Think of it this way. Traditional bite-wing X-rays are like a magnifying glass. They show small, super detailed sections, which is perfect for spotting tiny cavities between your teeth. The panoramic, on the other hand, is the wide-angle lens. It shows the entire mouth at once. It's the go-to for seeing the big picture, your bone health, jaw alignment, the whole shebang.
And finally, the practical question that's probably on your mind. What's this going to cost?
Well, it definitely varies depending on your dentist and where you live, but the typical cost for a panoramic X-ray usually lands somewhere in the range of $100 to $250.
All right, so after all that, let's zoom out one last time. What is the big picture takeaway here? I think this quote from our research really sums it up perfectly. The panoramic X-ray truly is a cornerstone of modern dental care.
At the end of the day, it's not just another dental appointment. It's a really simple, safe, and incredibly powerful step that you and your dentist can take to protect your oral health for the long run,
simply by seeing the whole picture.
So now you know what that big picture can show. Kind of makes you think, doesn't it? What's the full story your smile has to tell?